This is Skull Project Part 7, the anatomy of local anesthesia. This is the posterior superior alveolar that covers the maxillary molars except the mesiobuccal root of the first molar. Next is the anterior middle superior alveolar that covers the maxillary premolars and the mesiobuccal root of the first molar. Right next to that is the anterior superior alveolar, which covers the maxillary incisors and the canine. And then we have the anterior middle superior alveolar that covers the palatal tissue, molar to the incisors, the pulpal mesiobuccal cusp of the first molar to incisors, and the buccal tissue premolar to the incisors. You can see that right there. Next is the infraorbital, which covers the pulpal and buccal tissue of the mesiobuccal first molar to the incisors. And this is the same as the MSA and the ASA conjoined. Then we have the greater palatine, which just covers the palatal tissue from molar to premolar. And outlined in this triangle is the nasopalatine that covers the palatal tissue from canine to canine. Now on to the mandible, we have the inferior alveolar, which covers the pulpal molars to the midline, the buccal tissues premolars to the midline. Now more towards the inferior, or I guess inside this orange line, is the lingual that covers the tongue and lingual tissue. It's next to the molars to the midline. And then this pink area is the long buccal that covers the molar buccal tissues. And then this area, indicated by the red line, is the mental incisive, which covers the pulpal and buccal tissues from premolars to midline. Lastly is known as the Gaugates, which covers the entire V3 division of the trigeminal nerve.